Ten years ago, I was diagnosed with trigeminal neuralgia, and that's what started all of this.
Carrie's a very interesting patient, very complex patient with an important history. She originally developed a condition called trigeminal neuralgia, which is some kind of compromise of the trigeminal nerve, usually inside the skull itself. So it's a neurosurgical problem, and it can cause pain to radiate in any of the three divisions of the trigeminal nerve. With her, it basically involved the whole left side of her face.
It caused what they said was complex regional pain syndrome, and then eventually I came up with myself the thoracic outlet syndrome.
They put that in. She says that it didn't help her, and so then they removed it eventually. And after removal, just this whole area of the neck and the chest and coming over into the shoulder, which is all within the anatomic distribution of those nerves, just kind of blew up.
I don't have a life. I have to lay flat. Sitting up like this, standing, is extreme pain. My husband does everything for me.
Most difficult thing is seeing her crying all the time and in so much pain, you can't do anything about it. It's really disheartening.
Pain is off the 1 to 10 charts. I mean, there's no level. There's no level for me to, it's past the 10. I cry a lot, but you can't cry all the time. You look at me, you think I look fine, and I'm not. It's just, I've been living with this for so long. The pain is just excruciating. It's unimaginable. It's just torture. All I've been doing is doctors and surgeries and procedures and medications, and it's just nonstop.
We've been everywhere. We've been to every corner of the country and haven't found anything yet, but we're hopeful. If this is the trick, it would be life-changing.
Looked at all of his videos, and and I was just like, this makes complete sense. He's the specialist in this area, and just everything that he was saying about the other surgeons and doctors that don't really understand that part of it. They understand their specialists, but specialty, but not his specialty. His exam was way more involved than I've ever had. I've only had probably 2 people examine me for the thoracic outlet, but it's not the same at all.
The development of these new symptoms as a complication of the peripheral nerve stimulator insertion and removal then made it so that any weight on the arm or any use of the arm was very painful. It's a situation where a bad problem has become worse because nobody's identified the original problem or fixed it. Ultimately, she's going to need a decompression of the brachial plexus with removal of the anterior middle scalene muscles, and then probably a neurectomy of the supraclavicular nerves, the transverse cervical nerves, and the lesser occipital nerves.
She could go from she says it's 100 pain level, but if you go from a 10 to a 6, that would be life-changing. We could go out to eat again. We could sit at a restaurant. We could sit at the dining room table and eat. She could sit up. we could go do something. I'm hopeful that this might be the solution. He seems to be optimistic, so I'm gonna keep my faith and pray that it works.
People with brachial plexus compression or thoracic outlet syndrome, which is the other term for it, it's, if that's the problem, decompressing the brachial plexus and removing the scaling muscles is very, very effective. I have a lot of hope for her that we can really impact her quality of life and make things much, much better.
Just need to push through and hopefully, get back here quickly and have my miracle, I hope.